Hopefully, again, we'll jump right into it. But before we do, I'll just say at the outset that as we look toward July 18th, we'll be back here next week, Wednesday, same channel, same time, on the 15th. We got a lot to go over today, but a lot will happen between today and next Wednesday. So look forward to seeing you next week as well. And with that, Dr. Bucks, you've got some daily updates, you've got some Regenstrief updates in and of themselves, and some updates on positivity rates, et cetera.
Thank you, Governor. Good afternoon, Hoosiers. Today we reported 455 additional cases of COVID-19 in the state of Indiana, which brings us to a total of 49,063, the total number of Hoosiers who are known to have had COVID. We also saw 15 additional confirmed deaths. To date, 2,539 Hoosiers have died of COVID-19, and another 193 are believed to have died from this disease based on their clinical diagnosis. Our ICU bed and ventilator capacity remains steady, with more than 39% of our ICU beds and nearly 84% of our ventilators still available. We have also seen nearly 536,000 Hoosiers tested for COVID-19, up from just 490,000 a week ago. I want to share the latest data from our partners at Regenstrief regarding the statewide hospitalization and recovery data. Regenstrief has looked at over 47,329 cases this week. Of those, about 25% visited the emergency department, which is steady from last week. A total of 7,333 were hospitalized, which represents 16% of all the positive cases. This is also basically unchanged from a week ago. Of those who were hospitalized, 21% were admitted to the ICU, which is consistent with what we've been seeing in past weeks. This represents 3% of all positive patients. 74% of hospitalized patients have been discharged, which is steady since last week. Of the remaining 26%, 7% are believed to still be hospitalized, and nearly 19% are known to have died while hospitalized. Regenstrief also estimates that 78% of patients have recovered, which is the same since June 30th. We continue to monitor the data surrounding our 4 guiding principles for our phased reopening: hospitalization, surge capacity, testing ability, and contact tracing. What concerns me is that we're seeing more overall COVID-19 infections. Our current positivity rate is increasing, meaning that of the Hoosiers tested for COVID-19, more have had positive results. The 7-day average positivity rate in Indiana was 5.9% through July 4th, but the single-day positivity rate on July 4th was 6.4%. The rate has steadily increased. By comparison, our lowest positivity rate was on June the 18th, when the 7-day average was 4.1%. With more cases, we're also beginning to see an uptick in hospitalizations over the last few days. On July 7th, 667 COVID-19 patients or persons undergoing testing for COVID-19 were admitted to hospitals across the state, up from the low of 595 patients on June 26th. As we've talked about before, the positivity rate is one of the key principles driving our decisions for the Back on Track Indiana plan. The rates of positive tests have been rising in specific areas throughout the country, and we're also seeing a few localized hotspots in a handful of Indiana counties. We anticipated this, which is why we paused the reopening plan last week, and that decision has been confirmed by the numbers that we've been experiencing. When we moved to stage 4.5 last week, we kept many guidelines at stage 4, but we also opened some larger activities such as festivals and camps as long as social distancing, masks, and other prevention plans were in place. But in consultation with the Indiana State Department of Health, and following the slight uptick of COVID-19 cases, and after having discussions with us, the Indiana State Fairgrounds and Northern American Midway Entertainment has decided to cancel the Fairgrounds Fun Park that has been planned for July 31st through September the 7th. The carnival provider and State Fairgrounds had a thorough and very thoughtful plan on how to conduct the event safely, but have concluded that it's best not to move forward with the fun park. Smaller 4-H livestock shows will be conducted at the State Fairgrounds. I'd like to remind Hoosiers, whether you're planning on attending an event or just planning to attend an event where there will be lots of other people, please stick to the safety plan that you created. Wear a mask, keep socially distanced, wash your hands frequently, or use hand sanitizer. Stay home if you feel sick, and of course, get tested. Those strategies are there to help protect yourself and each other from infection while enjoying some very long-awaited fun and entertainment. Thank you.
Well said. It can't be said enough, I guess, though. As good as the plan is, and we've seen a lot of good plans, they got to be followed.
Exactly. And I can't tell you the number of times we've seen through contact tracing that people have said, we had a great plan, we just didn't follow it.
Yep. Thank you. Luke Basso from the Indiana Economic Development Corporation, you've got some updates on PPE status, inventory, even some shipments going out to schools.
Yeah. Thank you, Governor. Luke Basso, Chief of Staff, Indiana Economic Development Corporation. Since the beginning of the pandemic, the IEDC has been focused on securing personal protective equipment for the state to be used by healthcare providers and then to also help businesses be able to safely reopen. We have not taken our foot off the gas since day one, and each week we are securing more manufacturers and buying more equipment so that we can help guarantee our state and its workforce and healthcare providers can protect themselves as we continue to navigate the pandemic. And to date, we have received more than 26 million pieces of PPE. Our next task is helping Indiana schools be able to safely reopen. At the direction of Governor Holcomb, last month, the IEDC procured over 3 million reusable masks that will be used for Indiana's K-12 public and private school student population. Students at each of the participating schools will receive masks for them to utilize during the school year. IEDC, through a survey with the Indiana Department of Education, was able to identify the need for each school throughout the state. The program was made available to all public charter, and private schools in Indiana. As of today, we have 472 school corporations, charter schools, and private schools participating. In addition to the reusable mask for students, the participating corporations or schools will also receive 500 disposable masks, 2 or 4 ounce bottles of hand sanitizer, and 10-gallon bottles of hand sanitizer. Over the past 2 weeks, the IEDC has been working with Langham Logistics to coordinate contacts and a delivery timeline for all participating corporations or schools. Langham Logistics will begin coordinating with contacts today, and deliveries will start to take place on Monday. Participants will be receiving their bundles based on when the school is reopening for the school year. I please ask schools to be responsive to emails and phone calls you receive from Langham Logistics so you can promptly receive your supplies. Governor, in addition, the Indiana Small Business Marketplace launched on May 6th, and after 2 months, the marketplace has fulfilled more than 30,000 orders and delivered to more than 600 cities. In recent weeks, we've seen a decrease in bundles ordered, and companies have been asking for more access to additional supplies. Today, the IEDC will launch the Indiana PPE Directory, transitioning from the Indiana Small Business Marketplace. The PPE Directory will provide a long-term, reliable, and credible solution for businesses and nonprofits looking to procure PPE. The directory, which is available online at backontrack.in.gov, features Hoosier companies manufacturing or distributing PPE, items such as face masks, face shields, goggles, hand sanitizer, among other items. Users of the website will be able to work directly with the companies to view available products and immediately place purchase orders for the PPE. Currently, the directory features 12 Indiana companies with more applications under review. All companies on the directory have been vetted by the IEDC and are required to be headquartered or incorporated in Indiana. Hoosier businesses interested in being featured on the Indiana PPE Directory are encouraged to review additional eligibility requirements listed online and to contact PPE Directory at iedc.in.gov. Thank you.
Thank you. And we will go directly to the Q&A portion.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon. How are you doing?
Doing great. How about yourself?
Good, good. 2 quick questions, probably both for Dr. Box. First, on positivity, I've been noticing that uptick as well. We hear from a lot of people that, well, Indiana's just testing more. So can you just explain how a positivity rate is kind of a control for that up and down that we see at testing? And then second question, as cases were rising for a while, we were hearing a lot of people talking about, well, you know, this is just getting us to herd immunity. But everything that I've seen about herd immunity talks, you know, that we would need to see 70 to 80% plus people immune to the disease. So my question is it really feasible for Indiana to get to a point where we may have some herd immunity to COVID-19 without a vaccine?
Thank you. They're both excellent questions. With regards to the first question, we know that numbers of cases, just absolute numbers of cases, will go up as we test more individuals. And we want to continue. We have the ability to test more individuals. We want more individuals to go and get tested. If they're suspicious, concerned, if they're symptomatic at all, if they think they've been exposed to someone who's symptomatic, please go and get tested. But the important number for us is, of those numbers that are tested, how many come back negative and what percent of those numbers are positive? You want to be testing so many people that your positivity rate is really down below about 5%. That's where we would like to be. That's what we would like to see. And Indiana actually was down about 4.1% kind of mid to later June. And now we've seen that creep up, and as we've seen it in some pockets across the state. And that can be a sign that we are seeing more actual outbreaks, more actual cases, not just related to the number of people that we're testing. So that positivity rate is something that we really hang our hat on and look at, and it's something that you can look at every day on our website at the www.coronavirus.in.gov. You can actually pick the particular region that the county is in that you're interested in, and then click on that county, and it will give you the specific county data there. Now, with regards to herd immunity, we have some kind of new studies that have come out indicating that this coronavirus, like other coronaviruses, those viruses that cause the common cold, tend to behave the same way. And that is that, you know, we have some viruses where you get it once in your life and you have immunity forever. You're never going to get that virus again. You have other viruses, something like HIV, that you may get and probably will have forever and be able to keep that under control with medications. The coronavirus people get, they develop some brief immunity, the ability to fight that virus off, but unfortunately that immunity doesn't stay around, and that's why we keep getting the common cold over and over again. And that's what these recent studies have indicated, is that even individuals that do develop immunity, develop antibodies, unfortunately those antibodies in many cases are disappearing very quickly. So the concern there is that it doesn't matter how many people we expose, we are not going to probably develop herd immunity, and unfortunately we may just end up with a lot more individuals that have severe consequences or die from this.
And I would just add, again, I'm not a physician. I take my orders from a physician. But, you know, Steve, when you talk about herd immunity or banking on a vaccine, that doesn't account for between now and then. And then is way off in the distance. And as the Fairbanks study showed us, if we're at 3% that have had or have it currently, we're talking about 97% who haven't yet. That's right. And it's still an uber infectious virus rolling around the hills out there. And so we have to focus on controlling what we can. And that's our own behavior. That's how we slow the spread, so that all of a sudden you're not looking at a positivity rate of 14 or 50, or what we're seeing in some other places around the country. So it's just critically important that we don't hope for a vaccine. I'm hoping for it, but just that's not the strategy. And that's our hope for sure. But or herd immunity is so far off. You know, talk about 70, 80, 90%. That's way
even
down.
those county or those countries that have tried it, like Sweden and the UK to some extent, have really not been successful. When they have looked back, they've seen maybe 7% of their population in prevalent studies that are immune, so, or have any antibodies. I wouldn't even call it immune. And that's why we've been so careful when people have asked us about antibody testing, is that just because you have antibodies, we don't know that that keeps you from getting infected again.
Yeah, and sometimes you're, you know, it, like you just said, it comes back in 4 months, or sometimes you remain positive for 45 straight days. So, I mean, the overlap here is, the focus has got to be control. We got to manage our way through this, and we got to make sure our healthcare system is not overwhelmed, so we can care for those folks who are positive, who go into the emergency room and then are hospitalized and into the ICU beds.
That's right.
That whole process.
Kayla Sullivan, Fox 59.
Hi, Governor. How are you today? Sorry about that. I'm a little late on most some days.
Very good. How are you?
I am doing all right.
Good.
I wanted to know if you would be willing to comment on the investigation in Bloomington. We've really been having a lot of lawmakers asking you to make public your opinion on this investigation, as well as we were wondering if you could maybe give us more details on the role of DNR in this investigation.
Well, I can comment on it. I'll be brief about it just because it is, as you just allude to, an ongoing investigation. The brief video clip that I viewed with my own two eyes was beyond disturbing, and that's why it's very important that the DNR, and they will, complete their investigation sooner rather than later. They're working on that. I think it's right around the corner. And then they will in turn turn it over to the Monroe County prosecutor, and they will take it from there. And this is, from everything that I've reviewed, the DNR has always and continues to act absolutely appropriately per protocol. And so that investigation will be turned over to the county prosecutor, and they will take it from there.
Justin with the Westville Indicator.
Good afternoon, Justin.
Good afternoon, Governor. Dr. Box, you had stated last week that the testing numbers on the state's website show the number of individuals tested rather than the total number of tests conducted. Will the state be releasing additional data to give us a clearer picture about the number of individuals who have been tested multiple times?
The last time I talked to them about that, we had over 100,000 additional tests that would be on there if we included that. But I don't know that we have it broken down as Mary Smith had 3 tests or John, Ford had X number of tests. So I can certainly ask my data team, but they did correct me on that, so I wanted to make sure I corrected it.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. I can't tell you how excited I am about that nursing home database. Just to start off, I wanted to ask about the infection control survey specifically. We completed those a month ahead of schedule, even though we kind of have a high per capita rate of facilities compared to some other states of similar population sizes. So I wanted to know how exactly those infection control surveys were prioritized and how the state was able to complete those on such a fast pace. And then I have a second question.
So to my knowledge, we had already been working on those infection control surveys and didn't realize there was a drop dead date that those needed to be completed. So we basically just were able to wrap up the rest of the surveys. I mean, we have a great survey team. They have been incredibly actively engaged, and we have put more manpower toward that because we've needed it from infection control around the state for further education and helping to do infection prevention and cohorting individuals that are positive for COVID. And the other question that you had?
I just had a little curiosity about that interactive dashboard. Is it going to be able to sort by a point in time versus cumulative? And then will the results from the staff testing be part of that dashboard, or will that be a separate release?
The results from the staff testing will be a separate release. We currently have Fairbanks School of Public Health and IU's aging division that are looking at that data to try to help us to analyze the data so that we can use that to actually direct, do we have to test, every single employee every week, every month, or can we identify maybe hotspots in the state and do testing? So is there a correlation with certain hotspots and do testing directed based on that? So they're looking at all of that data, and we hope to have some further information by the end of the month on that. When we look at the long-term care data, the plan is to have a dashboard so that you will be able to search by the particular facility that you want. You should be able to look at the number of infections and when those infections occurred in the facility. You should be able to look at the number of employees that were infected and the number of deaths of both residents and employees. And there may be more on that I'm not familiar with, but I do know that they're trying to make that very user-friendly.
Sarah with WNIN.
Good afternoon, Sarah.
Good afternoon. This question is for the governor and Dr. Box.
Okay.
Vanderburgh County has seen a surge in cases, we're told, among young people who have been traveling to places like Florida. We have one instance of a graduating senior who went to Florida, met some people from Texas there, came home to Indiana, attended graduation parties, and a few days later tested positive for COVID. With school officials working furiously to make plans for the school year, how would you encourage young people and their parents to act responsibly leading up to the start of school?
You said Vanderburgh County?
That's right.
Okay.
Yes, you want to go ahead?
No, go ahead.
We have seen an uptick of cases in Vanderburgh County, a little bit in Warwick County, and have been in contact with officials there. The Deaconess Hospital is doing testing there, and they have additional testing open for the public. I would say that they have an excellent health officer and health department there who are all over this and taking really good care to make sure that they help us in the contact tracing in this situation. The personal responsibility for our young adults is something that I, first of all, realize we are not going to reach them at this 2:30 presser, Monday through Friday. So we are really looking to figure out where in social media and what areas we can reach out to them and how it's going to resonate with them. Because young adults and even teenagers are very passionate about the things that they care about, and they will stand up for what is right. And so we have to be able to give them the message in a way that they understand that it's critical that they are the difference in whether those infections are brought home to maybe their mom that works at a long-term care facility or their grandma that has underlying health conditions. So we are looking into that and working very hard on making sure that we do reach individuals.
Yeah,
in
we
that age group.
were, Sarah, going back and forth about this. You know, it can't just be us in this limestone building or health officers in 92 different counties. We got to get out to the broad citizenry and connect with each Hoosier, and that may mean, you know, college student athletes saying, if you want to watch me play football or basketball, mask up. Or it may be students talking to their cohorts or to their parents, if you want me in school, mask up. And because I think they want to be in school. I think parents want kids by and large in school. I think the kids want to be back. I think a lot of our college students want to be back on campus. And we can do this, and we can do it safely. But once again, I sound like a skipping record, but it comes back to our conduct. And so as Luke went over, we're making sure that we get all the safety, the PPE to the schools so they can. We have plans in place, school by school. You've hired a full-time person to liaison back with all the local health departments. So all the pieces are there to be able to do this. And it can be a hybrid as well. But Sarah, you tap on something that's very important here, is how people consume information that's good for them. And so we're looking at other voices getting part of this campaign to get the word out.
Eric Berman, WIBC.
Good afternoon, Eric.
Good afternoon, Governor. I wanted to go back to continue on the question of schools. We've got thousands of students going back to school, hundreds of their teachers going back next month. Under what circumstances would we look at going back to online? Would that reflect a certain increase in the community? Would it have to reflect infections within a school itself? And how big an outbreak would prompt that?
Well, it's not a single factor. Certainly, the plan that's in place in every school, and we're obviously working hand in glove with each school corporation and the leaders there to make sure that they're carrying out their plan, and with the local health department. So if you're looking for just one indicator that says, you know, they score off the chart here, that's not it. It's a whole series of questions that have to be asked, and, you know, the rate of which it's occurring as well. You want to add?
Well, when we look at it, you would have to look at where are the outbreaks. So if a community has a particularly high positivity rate, is that because it's in a particular industry or a business there or a long-term care facility? Is this just in one classroom in the school, or is it in every classroom? Is it in all grades? Is it your staff, your teachers, and everyone? So it's really more, as the governor says, a consultation between the superintendent and principals of those schools, along with their local health officer for that county, and the State Department of Health. If they would like us to be engaged with that, we would be happy to be engaged. So it's, Eric, I wish I could say, if you get above this percentage of students that are homesick with these symptoms, we're going to have to call school. We're going to do what we can to try to support schools so that they can stay open. We think that's important, not only for the educational experience of our students, but for their mental and their physical health also.
And for the parents who want to get back to work as well, that maybe can't right now. But Dr. Box just brings up a very important point, and that is we're going to be at this for a while. This is not, one day's numbers or one report. This is going to be over the course of the rest of the year and beyond, potentially. And so that's why we'll continue to, and what I'm pleased about is we have these connections and relationships with all 92 counties, health departments, and with schools, and with the Department of Education, et cetera. All the partners are there that we're going to have to make one-off decisions throughout this whole process. And we're going to be looking at a lot of numbers, not just one set.
Caitlin, WPTA.
Good afternoon, Caitlin.
Hello, sorry, it took me a second to get unmuted. This question is for Dr. Box. Does the state government's decision to publicly release COVID-19 data in long-term care facilities violate privacy laws or single out potential COVID-19 patients by identifying facilities and outbreaks? If your answer to that is no, could you please explain how it doesn't?
Well, I think that very early on in the situation, it would have been worrisome to me that we easily could have actually violated an individual's privacy because of the small number of cases that we had and where those were. Now, by looking at this data and at the request of the AARP and the request of the associations that represent our long-term care facilities, they want us to post this data. There won't be individual persons' names there or employees' names, so no residents' names and no employees' names. But when the cases occurred, you'll be able to see, are those cases that have occurred recently, or are they cases that occurred very early in the outbreaks? And you'll be able to see whether they're deaths that have occurred more recently or deaths that occurred very early in this process. And so there's no ability there to identify any single individual with the data that we'll be giving.
The only time that happens is when it's directly to the caregiver or the family.
Oh,
if a case, yeah.
Correct. We would talk with a family, but we wouldn't even then tell the resident, that lives there or their representative that it was their roommate that's positive or so-and-so that's positive. We're very careful to try to, in contact tracing, just say you have been in close contact with and explain it that way.
Yeah, so residents shouldn't fear that their name is going to be splattered all over the
no.
universe. Yep.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Good afternoon, Governor. Just two quick questions. One, are you still planning on attending the Republican National Convention in Florida? And two, why do you think Indiana generally has done better, managing COVID than other red states?
Well, I don't want to take number two first. I can give up. Let me answer the first one, you answer the second, and then I'll add to it. That is the plan. That was the plan, but that's August. And one thing that I've learned throughout this whole process is don't make vacation plans too far off in the distance because things change on the ground. And that leads directly to your second question, quite frankly, and that is 1 week folks feel like they've dodged the bullet, and the next week the whole terrain underneath their feet has changed. And so I'm not going to take my eye off the ball, and I'm not going to find myself in a sea of humanity anytime soon. And we would have to do it differently than it's ever been done before. But having said that, I'm going to worry about July right now, not August. Would like to go, but quite frankly, I've not booked my flight yet. Second question, then I'll add a couple.
So I think that question is a very broad question, but I will say, number one, I think that the leadership has been tremendous in this with the governor, and that he brought us all together at the table at the same time, and he made sure that every silo that was there was broken down, that we would work across agencies and across government entities to make sure that we were all working together. We immediately brought data into this and developed a data team, and we have been data-driven from the very beginning. We developed strike teams and addressed those highest risk populations, those concerns that we knew would be in long-term care facilities, and addressed it from the standpoint of PPE and education and infection control and cohorting. We made sure that we had great partnerships with the Hospital Association and our providers across the state. Our hospitals came together in ways that we've never seen before and partnered and shared data and shared patients, and our EMS worked with them to make sure that we could give the best care to every patient that was sick, whether it was from COVID or from something else. We had external partners like Lilly step up and help us immediately to be able to start testing here in the state and to make sure that when other states were experiencing what we were, which was limited reagents, the inability to extract the genetic material that we needed to test this, they stepped up and were there for us. And I could go on, but I think that those are just a few of the things that have come together in a very important way.
Yeah, and I would add that everything that we do, we follow through. We don't, we're not knee-jerk, we're not reacting in a hodgepodge way. Whether it's testing, we've very methodically continued to expand our testing capability. There's not a day that goes by that we don't have more capacity. When we have the drive-throughs and Optum's open and through the week, we've got the ability always to test more. Tracing, quite frankly, when we hired about 600 people to step up and do the tracing and actually contact 75 to 80% of those folks, and then make sure that the folks that we don't give up, but we also give that information to working with the local health departments. Our Fairbanks study is something that no other state's done, so that's our radar. That's how come we're looking out into the future. And maybe most importantly, I said earlier, I sound like a skipping record, or you said one time a nagging doctor, but it's not that we always just point out the bad. It's Hoosiers have done I get out and about, and for every time I see someone not wearing a mask, I see people wearing masks, and this is a social compact. This is between you and me and you and him, and this is how we're gonna get through this together. And so when you talk about our hospitals or Lilly or Roche, or addressing food insecurity, or addressing the homelessness issue that's been amplified during this whole process, we actually stick at it. And I see other folks, you mentioned a couple foreign entities or referred to some other countries that have kind of changed their tune over time. And we're very thoughtful about it. So I'm not trying to brag on us. There's others that are steady as you go about this as well. But we know that ultimately, if we're well conducted, meaning everyone in the state of Indiana, that's how we're going to get through this both swiftly and safely.
Michael, WBEZ.
Good afternoon, Michael.
Good afternoon, Governor, and good afternoon, Dr. Box. We continue to see positive cases go up in areas of Northwest Indiana, such as East Chicago, which has the highest positive rate in the region, and it's a city that is more than 50% Latino. Are there any plans to set up a permanent optimum site in the urban core of Lake County? That's been suggested by Representative Earl Harris Jr. And do we know if there will be any studies to see why are these high minority areas seem to be affected by the virus and other areas, like sort of what are the common factors? And my last question is, some Northwest Indiana residents are wondering if there's any truth to these rumors that some local hospitals have closed their COVID wards.
Okay, we'll start with first. Permanent.
Which is a long answer to a short question,
Yes,
but a really long answer.
So permanent sites. First of all, we did see the uptick in East Chicago. We are in Hammond right now, but as of Friday, they couldn't get the site open till Friday because the space that they want us to use in East Chicago is not open till Friday, but we will be set up doing testing in East Chicago again. 45% of our drive-through testing has been in Lake County, in Hammond, East Chicago, Gary, Maryville area. Yes, we have actually already been in contact with the Gary mayor, and we'll be setting up a permanent Optum site there, and actually have a couple of options for sites there, and have already reached out to the mayors in East Chicago and in Hammond to put a permanent Optum site there. Any studies done to determine, I can tell you that many of these populations are in larger urban populations, and that is the highest risk population. So it's going to be the Marion counties, the Lake counties, Allen counties, where we tend to see these outbreaks. And especially it is our urban areas oftentimes where we do have some of our minority populations. So that is what, we're seeing, and that's what we expected to see. The last one was, taking down their COVID units. We have seen many hospital systems that have reverted rooms that they had kind of set up. This is going to be able to be an ICU room if we need that, back to just routine med-surg rooms in their hospital, with the ability to convert that immediately back to a COVID-based ICU room if they need to. So that has kind of happened quietly. You may have noticed numbers of ICU beds that go up and down on our website, and that just basically is because some people are saying, we don't have that many designated ICU beds. But we do know our hospitals are standing at the ready and that they are prepared for another surge, which we expect we may see in the fall.
You want to just elaborate that you bring up another pretty important point, and he scratches at it, and that is the agility and how that's really a strength, Optum included, how these sites can have the ability to move around. So if they're in a school today, but they can't be in a school 3 weeks from now, we have the ability to move it to another location, or where there's better airflow, or a number of examples. But you just might want to talk about that agility as a strength.
Optum has been, our drive-through testing done by the State Department of Health, we're very mobile. And going forward, we're going to be even more mobile. But we can set up at the drop of a hat, and they have done that for us, and I've been very appreciative of that. The Optum sites, usually within 3 to 5 days, can move their site for us to where we need them to be. We originally, as you know, set the Optum sites up on a lot of our armories across the state. The general was very happy, and we were very blessed to work with him so that we could have those sites to start out with. Many of them, or I don't think any of them, are air-conditioned sites, and some of them are not as close or convenient to the population as we'd like. So we've been working community by community across the state to help move those sites to places that are air-conditioned, because OSHA has rules, and it gets pretty heavy. I can tell you the day that we did the testing out in the parking lot on that black hot the tar out there that they had just done was extremely hot. But when you have all that PPE on, you need to protect the individuals that are there doing the registration and the testing. So we are in the process of moving them, but Optum has been very adaptable with us on that, and very willing to move around as needed to different places. And going forward, our goal is set to make sure that every county has a site like Optum, or a site that we've helped their local health department or local public health people set up, so that there is always testing available and convenient.
Did you just make a plug for the Brigadier General?
I
to put
did.
To put AC in every armory in the state of Indiana?
You're gonna
Go to the next question.
Hope with the State House file.
Good afternoon. Hope?
Hope, you should be able to speak. We'll come back to Hope. Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Hello, Governor. I have two questions. The first is about testing. You guys have mentioned the importance of testing, but I noticed there are only 33 Optum sites up right now. And I've had a number of people, including someone today, say that they keep getting their appointments canceled and that they can't get an appointment. One person a 15-minute notice today that their thing was canceled. So what is the status of that contract, since I think it was only another month extension, and why are we having trouble? Why are people having trouble getting appointments? And then I have a contact tracing question.
Okay. You want to, I mean, I kind of got at part of the answer to that, but you want to complete the answer?
Sure. So the biggest problem that we're having, as I mentioned with the Optum sites, is the heat right now, and many of them are in areas that are not air conditioned. And so once that heat gets up to be about 78 to 80 in their personal protective equipment, they will shut down. And unfortunately, in order to go as long as they can, that ends up being a last-minute decision. What we've asked and what I think has been happening is the Optum call center has actually been calling individuals to let them know and to try to reschedule them. But I'm sure that there are people that unfortunately find out about that at the last minute. Now, with regards to appointments, Nikki, I don't have a specific answer on that other than to say that the Optum sites, you don't have to have an appointment. You can, and if that works better for you, you can do that. We are working with communities to determine who wants, we have some communities that say, oh, we don't want the Optum site anymore, or we want the Optum site moved, or there's an air conditioning or a heating problem here, people are getting too hot. So we are trying to work community by community. Some of them have been in schools, and so now that schools are getting ready to reopen, we are having to shuffle those sites around. So it really has been a question of being able to work with communities and county commissioners and the mayors to try to determine where we can move those sites. And as far as the contract goes, that contract is signed through the end of July, and whether we extend that contract is under discussion at this time.
You had a follow-up, Nikki, I think?
Yes, I had a question on contact tracing. Can you tell me how many counties the state contract is handling contact tracing for, and how many people you have hired? I know Allen County decided to take their efforts back, and so I just wanted an update.
So Allen County was receiving their feed from the hospital there, from Parkview Hospital, sooner than we were even getting it in MBS, because they were manually entering it into our MBS system. And it is the case being generated in MBS that was going to our contact tracers at the state level. So we've been able to work with Parkview and to figure that out. They were great partners in that. But Allen County has really helped us to fine-tune and push ahead and make this system better so that there's more interaction at the state level with our county level individuals. And I give Mindy Waldron and her team up there a lot of credit for that. We now have the ability for them, if they're the first person that knows about a case, to actually open the case and do the initial history and document that into the same Microsoft Dynamics that we are working in. So we are still working with Allen County. We are still sending out things for contacts and on a daily, do you have symptoms? If so, you need to get tested. But they are doing a lot of it on their own at their request. But we are doing contact tracing for every county in the state of Indiana. We have 650 contact tracers currently working and trained, and if you include all of the public health nurses and the contact tracers that are working with us across the state, that number is dramatically higher than that.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Two questions. First one, your thoughts on what does it take for Indiana to move past 4.5 or maybe go back to 4 and sort of the next level? Because with places like Texas and Florida and California seeing a lot of cases sort of grow. So what would it take to move that needle is my first question for you. And my second question, this is going to sound really weird not, so work with me. What are your thoughts on changing the name of Indiana? Because hearing just some sentiment out there that with names like Indiana, Indianapolis, that may be offensive to people who are Native American. Like I said, it's a weird question, so thanks for keeping a straight face with me on this one. Your thoughts on changing Indiana's name?
Well, I think we answered the first question in terms of there are multiple factors that the data will drive our decision, not 4.8 or 4.5 or 5 or where we want to get to or 250 people or unlimited amount of people. It'll be a series of data points that will lead us to the responsible decision. And so we're not, when we put these July 18th dates out there, that's just for us to take stock of where we are leading into that period of time and then make informed and intelligent, safe decisions. So I think you would concur.
I absolutely agree. And I think, Abdul, it's really a question of us giving it a little extra time to see where these numbers are actually going. Do they continue to go up? And we're trying to establish that perfect balance between being opened economically so that we can enjoy some of the things that we enjoy as a state and do the things we need to do and prioritize those things that should be and need to be done so that we can get our kids back to school and get our institutes of higher education open, but still at the same time be able to protect Hoosiers and visitors to our state.
You know, Abdul, no, I haven't given that any thought. Your second question, although I've talked with Native American friends of mine about our shared past and our heritage and how we can do a better job, we being myself, this administration, how we can do a better job sharing the story of Indiana, sharing the story of who we are as a people, a very diverse people, and to be able to celebrate our successes, to be able to acknowledge our shortcomings and deal with them. And I'll look to speak more about this in the near future.
Julia with Wish TV.
Good afternoon, Julia.
Good afternoon, Governor. I have a question about the mask mandate here in Marion County. Do you believe it is enforceable? Do you believe it is constitutional? And in light of this new COVID-19 data, are you open to a statewide mask mandate?
We have supported locals making that decision. Obviously, we've, for the State House where we've mandated it, and we'll continue to work with locals. It is constitutional. A business does have the right. This has been proven out. And what's really important that's been proven out is it works to slow the transmission of COVID-19. So if you cannot physically distance yourself 6 feet at a minimum, then masks help. And we'll continue to support, especially in areas that are seeing surges occur, where we want to draw those numbers down. And I think the facts will bear out that it does work. I mean, I think we'll be able to cite examples around the state of Indiana or the country where this is a way to get not just a handle on it, but to bend that curve back down. You may want to add.
We've even seen that. LaGrange County instituted a mask ordinance where they have to wear masks, and we've seen their numbers go down nicely. Elkhart's done that, and their number has stabilized and even, I hate to say this, but ticked down a little bit. So I'm hoping it stays that way. So, St. Joseph's County is doing a very good job. It is difficult to enforce. But again, I think that, gentle reminders to people, if you're going to come in, if we're going to serve you here in this restaurant, you need to put your mask on as we go to the table. You need to put your mask on as you go to the restaurant or restroom. And we need to continue to work with individuals to understand that. I mean, there's a question out there about is this just respiratory droplets, or does this virus actually hang in the air for a certain period of time? And there are researchers that are pushing WHO and CDC very hard to call this, an airborne disease. Either way, masks are the answer to that. So that's why we really want people to wear their masks.
And here's where it really dawned on me that I could do this. Is, on July 4th, we had 2 races out at the IMS, no fans, but the races were exciting, nevertheless. And the men and women that were down there on the track in the pit crew at 129 degrees were wearing their masks for the entire race. I think if they can do this, I can too. And so if they're worried about being outdoors with no one else around, at 129 degrees for more than 2 hours, it's the least that I can do. Yep.
David Douglas, NBC News.
Good afternoon, David.
Good afternoon, Governor. Thank you for your time today. I know you touched on it briefly, the incident in Lake Monroe over the weekend and what's happening with the investigation, but I just wanted to ask you, after seeing that video, and you said it was disturbing, as I think many people feel it is, can you see how Indianans might feel after seeing that video and just what that kind of conduct, regardless of what led up to it, might mean for other Indianans and how they might feel in the state?
Well, look, there are hundreds of thousands of people that go to our state parks every year, and it is the most family-friendly, picturesque, memory-making experience that you could have 10 out of 10 times. And unfortunately, where there's bad conduct, that is, yes, disturbing, yes, repugnant, yes, unacceptable, these cases end up in the proper hands of authority to make the right decision. And I'm proud of the DNR, the way they've conducted themselves. They've done everything right, by the book. And they'll continue to do that. And then it will fall in the hands of the Monroe County prosecutor to make the final decisions, and any others that are looking into this. And so, yeah, it'll be handled correctly, and was from the very outset.
We'll return to Hope with the State House file.
Good afternoon, Hope.
Good afternoon, Governor. So my question is for you about in light of the fairgrounds event being canceled, what your thoughts are if you're worried about the Indy 500, which is set to take place in August, since you just canceled another potentially big event.
Yeah. You want to talk, and I will too.
So I want to make it very clear that the leadership for the fairgrounds and for this particular amusement group had an excellent plan in place, and they really worked with us in consultation and worked to make the decision that they thought was in the best interest of Hoosiers at this time for this situation in Marion County. I know that the individuals out at the IMS are also working very, very hard to protect Hoosiers. And we have tickets. They've already reached out. Are you planning on coming? And if not, please let us know, and you can carry those tickets over. So I think they're working very hard and looking at all the data and looking at the number of people that want to come and actively be in the stands for the race. And I've seen many of the things that they have planned to protect people. It is an outdoor venue, so that does make me feel a lot better about the situation. And they do have a lot of great things in place to try to protect Hoosiers and our visitors to our state.
Yeah, and we'll continue to work with them. And it is a massive piece of property where you can physically distance, where you can mask up if you're, in close proximity to someone. You can fit Yankee Stadium, the White House, property, the Vatican, and football stadiums. I mean, it is just an enormous piece of property, and so we'll continue to, like you said, be in consultation with leadership out at the track. One thing that they've just reminded us of is they've always been about driver and fan safety, and they're showing that once again.
Meredith with WLFI.
Good afternoon, Meredith.
Good afternoon, Governor. So I have a couple of questions. One of them might just be a little bit of clarification, but we've had a couple of people reach out to us saying when they try to make an appointment at one of the Optum Serve sites, I think we only have one here in Tippecanoe County, it says that it's taking them, the next available appointment is over a week away. But I heard Dr. Box say earlier that there aren't appointments required. So is it all Optum Serve that don't have to have an appointment, or is it just some? And what would your advice be to those Hoosiers who can't get a test scheduled at that point? And then I do have another question.
All Optum Serve sites operated by the Indiana State Department of Health and State of Indiana, you can walk in and get tested and don't have to have an appointment. I would say individuals should go to our map. If for some reason they go to a site and the wait is going to be too long, there are multiple other sites, especially here in Marion County, where they can go and be tested.
You had a follow-up, Meredith? Didn't she?
Meredith, you should be able to speak.
I can't, unfortunately. Can you hear me?
Yes.
Oh, okay. Sorry. I didn't know you guys unmuted me. Sorry about that. So my other question is, Purdue University just announced that they are going to require all students be tested for COVID-19 before they return to campus. My question, I guess, is for you, Governor, and Dr. Box, is what's kind of your take on that? And is this something that you think other colleges and schools in general should be doing moving forward?
boiler up, hammer down, all the power to you. We're working with all of them, you're working with all of them, to make sure that they have the right intel to make the best decision possible. And doesn't surprise me, Purdue's taking this step forward.
Yeah, they've already had some students return and seen some positivity. Tippecanoe's rates have been ticking up a little bit, and they made that decision. They are going to use a saliva test, I think, to test students and send that, I think, through Rutgers to do that testing. So they have a plan in place, as do many of our other universities and colleges across the state.
Sherry with the Indianapolis Star.
Good afternoon, Sherry.
Good afternoon. Thank you for taking my question. I actually have two questions. One is I saw that the Dr. Mertz up in Elkhart County posted that some results are taking 8 to 10 days to get back because of the surge in coronavirus testing from across the country, with so many more tests being done in the South. And I was wondering what the implications are for contact tracing with that. And then my other question was, in terms of outbreaks, whether you've seen any outbreaks related to churches or specific bars or restaurants, and how you handle, or how the contact tracers handle information surrounding, kind of a publicly situated outbreak like that.
Thanks, Sherry. With regards to the delayed time, we have seen some increase in times from our labs that are sent out, like Quest and LabCorp. We have been working with the LabCorp that is here in the state of Indiana and advocating for Indiana tests to be run as a priority. And so, we're working very hard. We, through our lab testing network, are trying to help support them also with reagents and other things going forward. We want to be there as a partner for them in that. I had not heard as long as 8 to 10 days, so I don't know where that is, but I have heard more that 3 to 5 days rather than that 48 hours. And that makes contact tracing very difficult because it just puts you that much further into this whole thing. Although we do send the individual home who is tested and symptomatic and explain to them that they have to stay isolated at home until the result is back. And if someone's quarantined because they're a close contact and they get tested, they still have to do their 14 days of quarantine. So the same thing applies for them as far as not being in contact with other individuals.
And that just reminds me that I think it was Adam Wren who brought up, what do we attribute to our standing today compared to maybe some others around the world? And I think, not to pat ourselves on the back, but folks have done an incredible job throughout the state government and local government, one, working together, but two, in those population dense areas and those confined spaces, whether it's in our prisons or nursing homes or meatpacking plants, et cetera. I mean, when we see a surge, we're able to surge there and get resources there, and it's not spun out of the control as it has for more than 3 days, 6 days, 7 days, 8 days. And so what we're doing is truly managing our way through this. And I think that is a contributing factor to where we are, because as you note, whether it's Elkhart County or Marshall County or Vanderburgh or Tippecanoe or wherever where it starts to tick up, it's all relative depending on if it's ticking up by 10 cases or by 60. But being able to get in there and surge and meet that surge and then bend it down has been a key to where we are today.
There's one more thing I'll say, Governor, because Sherry brought up a really good point about, and this happened with a particular church, but we have found, some churches where they knew absolutely every individual that was there, and so they could be a good partner as we were contact tracing and knew who we had to reach out to. Other churches just had kind of an open, anybody can come in to Bible study over the weekend, come in for kind of church camp, and really didn't have a concept of who had even come from other counties. So one plea that I would make is, if you are having these types of events, in addition to the masks and the social distancing and not coming if you're sick, but please make sure that you do have everybody sign in and have a roster of everybody that comes and a phone number and maybe potentially an email to reach them.
Thank you for joining today's briefing.